Hi everyone, welcome to another segment of Inclusive Reflections. We appreciate so much that you're on board. Thank you for subscribing to our channel. If you haven't, we please urge you to subscribe to our channel so that you don't miss out on whatever content we put here, because here is what we usually say: we inspire one life at a time. We promised you and we are keeping our promise now and then. Today is an amazing day. I'm excited about this episode because it is a medical episode. And not only that, it is addressing one kind of people that rarely talk about their issues. By the way, at our Endangi checkup, today we are addressing prostate enlargement and prostate cancer. And with us is an amazing doctor who has been a good friend of mine. I want him to introduce himself, but before then, hi.
Hi, Teddy.
How are you?
In a while, how are you?
Good to see you.
Good to see you too. You're doing a good job.
Thank you. Finally, the day is here.
Actually.
We can't wait to hear what you have ready for us. But before then, please say hi to our viewers. Let them get to know you. Maybe wengine washaikuona mahali. Where have they maybe seen you?
Very well. So, thank you very much, Terry. My name is Dr. Anthony. I work in Potter's Family Hospital. Potter's Family Hospital, to our dear listeners and viewers, is located in Embu Township, the place called Mutondori Market. Just maybe you may be conversant with the hotel named the Marvel Hotel, right opposite. So thank you very much, Terry. Like I just highlighted, I think you're doing a good thing, and it's I think it's also be a pleasure sharing with the audience. Thank you.
Karibu sana. We don't want to waste so much time. We want to get to understand.
Yes.
There has been so many cases about prostate cancer.
Yeah.
I've had a sit down with a certain counselor around. Ameniambia amepatana na wanaume ambao they have prostate cancer, and unfortunately it's realized when it's in stage 3, 4.
Yeah.
And I know we are talking about men who don't share their problem. They barely see doctors.
Yeah. And
those are maybe some of the few things that have caused us to lose several men to prostate cancer, because again, who are you going to tell? You know, so we are here to get to understand everything around it, and without even wasting much time, please take us through what is prostate enlargement and what is prostate cancer, because I understand those are two different things.
Indeed.
Yeah.
Oh, very well. Perfectly. Prostate, I think it's a paramount theory. Before we discuss, sounds like you wish that we talk to the audience about the prostate health.
Yeah.
And yes, whatever you've actually noted is real as it is. Whenever it comes to men's health, and especially men at an advanced age, men have this problem in a poor health-seeking behavior, which I think by extension is one of the reasons for why prostate health is becoming a big blow to us providers and even to the society. So whenever we talk about prostate, I think, my dear viewers, sometimes my approach to healthcare, I normally like to say that whenever you want to treat a problem, you first of all got to be familiar with what the problem is, and rather it's said that you have to know what is normal before you appreciate the abnormal. So maybe someone may not be aware of what really a prostate gland is. And if you don't mind, I think it will be paramount if I share with the viewers about this whatever you're calling a prostate.
You are in a better position to understand better.
Yeah, so a prostate gland theory is a gland per se. It's a small organ, the size of a groundnut. That is normally there in the anatomy or the bodies of men, all male, the male population. And a prostate gland, for those of us that are familiar with reproduction, is an organ that serves to energize sperms during ejaculation, or rather when the men are engaged in sexual activity. So anatomically, prostate gland is located just adjacent to the bladder. The bladder is a reservoir for urine. When you realize that when urine is filtered by kidneys, when kidneys filter waste, urine is normally drains through ureters on both sides. Normally we have two kidneys, a right one and a left one. So when waste is filtered in the glomerulus and the Bowman's capsule, normally the body, blood flows through the kidneys and is filtered, and some waste, goes through to collect through the ureters from the kidneys, and that waste is what is drained as urine. So where the ureters leave the kidneys, they normally traverse downwards on both sides and join the bladder, which then the bladder holds urine temporarily before releasing this urine. So just next to the bladder, on the lower side, you normally call it the inferior part of the bladder, where urine is supposed to leave the bladder through the urethra to join the male penis. There's a small organ, which is now what we are discussing today. Is that organ is called a prostate. It normally surrounds the urethra, just nearby the bladder. So it's good to appreciate that a prostate is not a urinary organ, because maybe moving forward, we learn that we have conditions that affect the male urinary system. That is, for instance, UTIs and infections that affect the bladder, which have nothing to do per se with the prostate, because the prostate is a reproductive organ. But now, along the prostate as well, we have some connections of some other tubes now, which connect to the testes. So that the testes, which is now a different reservoir for semen. Whenever a man is ejaculating, the semen comes through these tubes and joins the prostate, and then the prostate evacuates through the urethra. So what we are saying is the genitourinary system, rather the urinary tract, normally joins with the genitalia, or that the genitourinary, the system, the reproductive system joins with the urinary system at the prostate. So when we talk about prostate enlargement, this is like we said, it's an organ that is really small, but you realize that over time there are changes that happen in men's bodies that culminate to the prostate sort of starting to enlarge. And whenever we talk about the prostate enlargement, it's good to appreciate that the prostate will enlarge on both directions. Sometimes it will enlarge upwards. When it enlarges upwards, it pushes the bladder, because this is a sort of a solid organ. So when it enlarges, it's going to push the bladder upwards, because the bladder is, you can give the imagination of a balloon that is filled with fluid. All right, that is the bladder. So an organ that is enlarging definitely exerts some sort of pressure on the bladder, and the bladder, then a patient now will manifest with what we are going to discuss, what we call the urinary symptoms. So the patient is having symptoms which really look like the symptoms affecting the urinary tract, rather the urinary system, from a reproductive system organ. I don't know whether we are together, Terry. So when we talk about prostate enlarging, or rather we say it can enlarge upwards, they can also enlarge backwards, and posterior to the prostate, rather behind the prostate, other organs, there are some muscles there, and we also have completely, totally behind, we have a rectum, which is another organ, which is now part of the large intestines, where they terminate to drain stool through the inner opening. So later we learned that even when we inspect the prostate gland, we normally go through the anus, all right? We feel it there, and sometimes it can enlarge and cause some complications in the digestive system, that is on the side of stool. Some other time, also it's good, notably, so to note that when the prostate enlarges as well, they can enlarge and narrow down the urethra, which we said now traverses through the urethra traverses the prostate, like the prostate covers the urethra. So sometimes it can enlarge and narrow down the urethra, and also culminate to a patient having genitourinary system symptoms. So maybe to going back to your question now, When we talk about prostate enlarging, normally under most circumstances, prostate will, whatever this enlargement is what we call prostatitis. In medicine, itis, whenever you talk about itis, is a suffix. A suffix is like an ending to a word. So whenever you hear in the field of medicine, itis, it means there is some inflammation. Rather, there is some sort of swelling going on. For instance, meningitis, it means the swelling of the meninges in the brain. Okay, arthritis, swelling of the joints. So, this itis means swelling. So whenever we talk about prostatitis, now this is enlargement of the prostate, and this is maybe what we are going to talk about. And like I just said to the viewers, the prostate enlarges for two reasons, which are the commonest reasons. One of them, and the commonest reason, is just a normal enlargement, which is affiliated to age. Rather, changes in the age differences in men. When a man, most men, whenever men get to the age of around 50 to 55 years, the prostate starts to enlarge gradually. We are going to learn what really causes this. And also we can have the prostate enlarging as a result of a malignancy. A malignancy is what in layman's you want to call cancer. Rather, cells that the cells of the prostate as an organ, developing some changes, or rather, the cells multiplying in a manner that presents in form of a cancer, which is what now is common to the population about prostate cancer. So, and this is also related to whenever we want to screen men, we are screening men to rule out these two conditions that a man, or rather our male patients, could be having either what we call benign prostate enlargement. Now the word benign means not cancerous. The word malignant means cancerous.
So that means those are two different conditions.
Different conditions, and they both are within the same organ. So it's either a patient has a benign prostate enlargement, is what we call basically we discuss a BPH, and we can also have cancer of the prostate. So precisely a cancer that is predominantly affecting the prostate as an organ. Thank you.
Let me ask a question.
Yes.
The enlargement and the cancer, do they have like it's male between this age that can get the enlargement, and the male between this age can get men between this age can get prostate? Is it age related?
All right. That's a good question. Normally what happens in the field of medicine, we normally see that common things occur commonly. All right. Like when a patient comes to the hospital and is presenting with an illness, it's always very paramount for the clinician or the doctor, I think, that particular patient, not to first of all think about the very serious conditions, but rather to think about the simpler conditions and narrow down to the most. No, what I'm trying to say is, yes, we have conditions that affect the prostate at a younger age, that's affecting the children and the youth, but mainly for the most conditions that affect the prostate are age related, whereby they are conditions that we manifest after the age of 50 to 55 years thereabout. You will notice that after the age of around 35 years, notably also it's good to note that the prostate makes some enzymes, rather some chemicals, and in fact we'll also learn that when we want to screen for what we have talked about, prostate cancer, we normally do some investigations, and one of those investigations that we conduct is a blood test, which is referred to as a prostate specific antigen. So these are markers in the prostate which are normally at a certain value in the life of a male, say a male patient, or a boy, or a man, and moving forward, which these levels they exceed the normal, the normal ranges. After that age difference, now when it gets to 45, 50, 55 years, 60, thereabout, they start changing, and those are the first, the primary markers, or rather the indicators that now guide us to now thinking about investigating further a patient for either BPH or cancer of the prostate.
Let me ask, what would you say are the main causes of cancer or prostate enlargement, according to the many cases that you have handled, maybe?
Very well. So, like I just highlighted, prostate enlargement per se happens to a big population, or rather, a big fraction of the population. Like most people, at some point in their lives, will have an enlargement of the prostate, which is not it's conditions which we call, conditions which have no cause. Rather that the causes are not very well identified, but there are researches that are still ongoing to actually be able to give an accurate cause for why this so happens. But now we have those risk factors, or rather what we associate to these changes that happen to the prostate in the society. And one of those, and the commonest, normally they are genetic factors, or rather hereditary conditions for certain genes, which cause a problem in the manufacture of a chemical that is manufactured by the testes, called dihydrotestosterone. So dihydrotestosterone is an enzyme which helps in the manufacture, in the development of the sperms, which are the male reproductive, the male reproductive units. So whenever there is a problem in the dihydrotestosterone, testosterone, it has been linked through researches to enlargement of the prostate. Per se, not to mention that it's going to be cancer of the prostate or BPH. We have other conditions that are hormonal related, like we can have hormones, which also relate to this prostate enlargement. Of course, we have other lifestyle problems, which also have been linked to enlargement of the prostate. I think that is one of the areas you don't have to really talk about.
Actually to ask you that question.
Yeah, we have issues like obesity, like people that are overweight, obesity and overweight. We have issues with diet, all right. We have issues with smoking, okay. We have people like, when we talk about obesity, people that live a sedentary lifestyle, all right, and so on and so forth. Yeah.
That means also alcohol.
Yes, to an extent. Usually what alcohol does, alcohol interferes with other organs, which have direct implications on these other risk factors that push patients towards development of cancer of the prostate. For instance, alcohol will sort of cause imbalances or other problems with the other malfunctions in other major organs like the liver and the kidneys, which also will now have an direct implications on the other risk factors that predispose patients to prostate cancer.
Okay.
Yeah.
Most of the time, will not go for a checkup, either male or female, because you don't know even the symptoms of whatever you are telling me about. So what you do say medically are some of the symptoms that men should look up to that will prompt you to seek medical advice.
All right.
Yeah.
Well, like we just said, the prostate problems are mostly problems of the aged, okay, or rather after middle age thereabout.
Would you define age? From what age would we expect the enlargement and maybe the prostate malignancy?
Perfect. So we normally tell our patients that it is crucial after the age of 50 years to start getting checked for prostate health, regardless of whether we are suspecting prostate cancer or BPH, because you realize that both of these conditions will have symptoms, and we'll have complications to the patient, which definitely are going to be bothersome for the patient. And talking about the symptoms, so that the viewer understands better, when these are the populations of the ages of the people slightly above our ages, rather even our parents, and so on and so forth. This population will at most times have symptoms, what we call genitourinary symptoms. One of these symptoms is what we call urinary symptoms, rather pressure symptoms. Like we noted that when the prostate enlarges, it pushes the bladder. So what happens whenever the bladder is pushed, the bladder has muscles which are called the detrusor muscles, which at the where the bladder terminates, there are some signals there, there are cells there, which sense whenever the bladder is full, and at that time, one is supposed to go and evacuate the urine.
Yeah.
So when the prostate enlarges, it affects, it tampers with that mechanism, and the bladder sort of fills quickly. Like when the bladder is pressed, you realize that the shape is deformed.
Yeah.
And also the urine that is getting to the bladder from the kidneys will feel quite quicker. And then the sensors that are supposed to sense when the bladder is filled up, they are impaired. So patients will have symptoms like, they start urinating more frequently. All right.
Yeah.
Patients will also feel what I call the pressure symptoms. Like patients will feel like voiding, or rather going to urinate more regularly, but to realize that they are not even passing as much urine as they are perceived. And then you'll also realize that patients will have what we call dribbling.
Yeah.
Rather post-micturitic dribbling. After men urinate, you might have noted that there are men you have they want to go void, but after urinating, because there are some remnants of urine that is trapped in the urethra because it has been sort of deformed by the enlarged prostate, the urine still drips in their trousers. Okay.
Yeah.
So urine is men try to empty bladders, but still it's not totally emptied. We have symptoms like that. Some other people will manifest with symptoms which are not related to the urine.
Okay.
Like for instance, they get, because there is what we call urine stasis. Urine is not totally evacuated.
Yeah.
And remember, urine is waste. Okay. So when it is held in one area, then it also poses a direct risk factor on the development of infections and something. So people will have rather men at that age will also present with infections, okay, of the bladder, or even infections of the urethra and so on and so forth. Other patients will also show symptoms of challenges with the libido and erection. And this is actually a common problem in our setups. Men after that age, have issues with their families. And many times they want to highlight that they have grown too old, but we normally talk to our patients. We tell them that this is and I like telling my patients that whenever you come to the hospital, Terry, if any doctor is to help you, the most important thing is not to treat the problem that actually brought you to hospital. It is to identify the cause of that particular problem, because every problem has a cause. Yeah. So most of these patients, when you investigate them for prostate health, you realize they have a direct connection to that presentation. And once you address those issues, some of them just resolve themselves. So and so on and so forth. Yeah.
Wow. So that means that there are several routine screening or checkups that men can undergo.
Indeed.
Do you mind highlighting them so that maybe someone would like, I can go for this, and maybe once they go to a doctor, maybe who even doesn't understand, I'm sorry to use that one, they can be in a position to say, I had Dr. Anthony say this kind of screening, and these are the symptoms that personally I feel, so I want this kind of screening. Would you mind like guide our viewers what kind of screening can men undergo, and is it again age? Is there an age factor that above 35 years and above I can go for this kind of screening? Above 50 years, this is the kind of screening that I can go for. Yeah.
Okay, very well. I think by extension, it's good to note that men have we began by saying that men have a poor health-seeking behavior. I think I'll beseech our men. The hospitals are made for patients, and whenever you develop a problem, it's good to think about how your problem can be solved, because the more you delay a problem, the more you have complications from that problem, and the more the condition can advance to affect you more adversely, and the more also you can also escalate the cost of managing that problem. And notably also, when we talk about cancer, we realize that whenever cancers advance, they also come with all these direct implications. So my advice to people, and maybe to answer your question, screening is at all levels. Whenever a patient has symptoms like the ones we've just discussed and many others, it is paramount to just visit a doctor or a clinician and go through these things. So normally what happens when a patient comes to hospital, we don't just go directly to investigating the patient, because you realize that when we talk about these things, some patients, we think they are so big or rather they are so scary that patients now want to also shy away from coming to hospital. Now, when we talk about screening of the prostate, it begins from the patient. If, for instance, you don't have a problem and you have come to for screening, or rather to have a prostate checkup, we will take a history. Rather, we are going to interrogate you on your general life, okay, and we'll also know whether you need these things. And we'll also be able to buy from your age or these other risk factors that we talked about. And then from there, we are going to examine you. Every good clinician, every good doctor will take you through some examination. And for men, after that age, it's normally, we've normally been trained to actually do what we call a DRE. A DRE is a digital rectal exam. Digital rectal exam, digital means our fingers. This is how we examine men. I began by saying that we can be able to feel the prostate through the anus. So this is how we feel the prostate, and you can feel whether it's enlarged or not after doing is part of the examination of the abdomen, the lower abdomen, because the prostate is a lower, or rather a pelvic organ or lower abdominal organ. So after that, then we do some investigations which do not cut across age. Like we'll do that blood test, which we began by saying is a prostate specific antigen, which checks prostate those antigen levels. The normal circumstances, they range between 0 to 4 nanograms per deciliter in the laboratories. So depending on how far they go, say like beyond 15, or rather slightly above 4, we'll be able to know is the prostate enlarging as a result of cancer of the prostate, or is it enlarging as a result of the benign form of prostate enlargement? Then we might also, depending on our findings, do some other invasive or even non-invasive procedures. We might do some imaging modalities like CT scans, MRIs, ultrasound to check how the prostate volume. We may do things we call true cut biopsies, and these ones come after now maybe the levels of the TSAs have gone so high. Those are more invasive procedures which we go through the anus, and we inject some needles to the prostate, and we get some biopsies. These are small pieces of the prostate, small pieces of that organ, which are then checked from the laboratories.
Honestly, from the description itself, it sounds like this uncomfortable. It sounds like an uncomfortable process. Let me ask, there's a way women we are told that you can check yourself for breast cancer, you can screen yourself. I don't know whether I use screening, forgive me if I don't use the right term, but can a man check himself without like having to go, because by the time maybe a lady comes to the hospital, breast cancer, I may feel a lump in the breast. Is there something like that when it comes to prostate enlargement? Can they is it something they can examine themselves? Yes.
Honestly speaking, the only way to examine, to self-examine oneself as a man for this prostate health is to analyze your changes in your various behaviors, rather, especially the behaviors in voiding or urine emptying your bladder, and also changes in the color of your urine. All right. Sometimes we'll have patients having blood in urine. Okay. Some other time we'll have patients losing appetite. Okay. What we call confounding symptoms, or rather symptoms outside of the prostate per se, which are resulting to a problem in the prostate. Like whenever a patient develops any form of, say, cancer, they'll have other symptoms like feeling like, anorexia, feeling like you want to vomit, losing weight, okay, losing appetite, okay, getting a little bit emaciated, symptoms like that. But there's no self-screening modality for prostate cancer, unfortunately.
So we say our men should concentrate on their daily routine.
Exactly.
It's more of, to men, it's more of symptoms. It has nothing to do with you can examine yourself. So please, our men, you've had the doctor concentrate on how you've had, or he has explained about the symptoms, and I believe if you feel there is something that is not adding up, or there is a change in your routine, just have yourself checked. So please, Dr. What are some of the treatments that are there for prostate enlargement? and prostate cancer? Are there, let's talk about the enlargement first. Are there treatments that are there in place?
Oh yeah, yes, yes, there are a number of treatments there, and we now, upon getting a diagnosis, that is when now we know what to focus on, rather what treatment modalities we direct to that particular patient. And just maybe what I mean is treatment modalities for this prostate enlargement are patient-centered, for various reasons. Like, for instance, is a patient having another condition? Okay. What is the patient's weight? All right. Okay. Is the patient hypertensive? Do they have blood pressure, like I just said, other conditions? The patient diabetic? What is the lifestyle? What I'm saying is, we when we talk about treatment, they focus on preventive and curative.
Okay.
So preventive is a patient will come with changes in the prostate health, but we have indirect reasons for as to why they are developing that condition. Say, like a patient is obese, or they are engaged in the activities that we said that can predispose that. We first of all treat that. We advise patients on lifestyle changes, and this can, the prostate can have a self-healing mechanism. That is one of them. The other thing is we have medications that we prescribe for patients for advanced conditions, like an advanced enlarged prostate due to non-cancerous sort of a problem. These are medications we give to patients. There are a number of them. Alpha reductase inhibitors, a number of them.
Okay.
And then we have other trainings we train patients to do. Like some exercises here and there. We also have other modalities. Like if cancer of the prostate is diagnosed, it is also treated. It can be treated surgically. Okay. Nowadays we do something called TURP, whereby we resect we reduce when we said that when the prostate enlarges, it presses on the urethra.
Yeah.
So the main problem that men will have is changes in their voiding or passing urine. So we take them to theater, and we resect part of the prostate that is enlarged internally, and the patient is able to get rid of those symptoms. We can also remove the prostate entirely, depending on the age of the patient. That's why I said again, they are also age capped. Then we also have, if it's cancer of the prostate, they can get medication through chemotherapy. They can go through the radiotherapy. Okay, we have hormonal therapies for the dihydrotestosterone changes, and so on and so forth.
Okay.
Yeah.
So that means someone that let me ask a question before we get to whether we can prevent it. That means that someone at what stage? Let's talk of cancer, prostate cancer. At what age would you say this is treatable and this is not treatable? Because honestly, a lot of people are fast on men. Ikijulikana, it's stage 4, stage 3. And is it that by the time it's there, they don't realize, or do we just, you see, you men, you don't talk. Women, a slight change too. I'll just have told someone I'll discuss it, and I think women are curious in a way.
Yeah.
But we are bringing this episode because we want them to know what are the dangers of I'm feeling a difference in my prostate, something is not adding up, but I continue to assume until maybe by the time I go, it is malignous.
Yeah.
It is stage 3, 4. If I noticed it when it was stage 1 or 2, would something have been done? Would I have saved myself from facing another death?
All right. So I'll divide that to answer that question well.
Yeah.
I think I'll classify treating a patient into one. Is one talking about a patient who has a BPH or is having an enlarged prostate, which is not yet diagnosed to have cancer.
Yeah.
And we have a patient that is diagnosed to have cancer of the prostate.
Sure.
And also is dependent on the stage to which the cancer has been diagnosed. You realize that maybe to talk about the ones that are already afflicted or have this cancer of the prostate, you realize that cancer is a big menace to the society, all right? And carries along a lot of stigma from the patient. But what I want to tell my clients is, and my viewers, is that whatever looks like it is so big or so serious to you, mentioned to you, might not be as serious to a specialist in that area. It's like the work you do, Terry. If you ask me to do what you do, I might not be able to even move an inch.
True.
You get the point?
Yeah.
So there's no condition per se that is known to doctors and other specialists that manage those conditions that they cannot manage effectively if a patient begins by accepting and rather trusting the process.
Okay.
All right. So by this I mean, and also on the same note, when we treat these conditions, we sometimes you're not focusing on really the cancer that has been diagnosed, but also prevent dealing with the complications that can come as a result of the untreated cancer.
Okay.
You get the point? Yeah. So it's very paramount not to have to seek treatment because of the stigma in mind about the cancer that's been diagnosed, because they can cause other problems which were not there in the first place if it ends up not treated.
Yeah.
That's number one. Number two, if you have a patient that people that want to prevent prostate enlargement, it begins now. Okay, it begins with learning about prostate health, which I think I can challenge our clients, rather our viewers, to just visit qualified people, rather qualified clinicians, doctors, and get to know about these things, because it's unfortunate and it is wise that also we as men and the other populations also we learn to with the current advancements in technology and media to associate ourselves in getting this knowledge firsthand. Because when a problem befalls you, then you get some sort of shock and you're not able to even research about that particular problem. That's by extension what I think is worth it.
Talk about lifestyle, because I can see time is far much gone on our end. Lifestyle. What would you recommend when it comes to men lifestyle to prevent prostate enlargement and prostate cancer?
All right. That one is normally a very broad topic, Terry.
I know.
Which is faced by a lot of speculations and a lot of questions and and a lot of unanswered questions for that matter. But basically, when we talk about prostate cancer prevention, we have preventive modalities which revolve around prostate cancer as a condition specifically, and we have other preventive modalities which revolve around prostate cancer and as a whole, as a whole topic of cancer management or rather cancer prevention, which also cuts across other forms of cancer. So we have what do we call them? Yes, we have these theories, hypotheses, which point towards preventing or rather which improve the health of the prostate. One of these things is diet. A good diet. This diet cuts across, generally avoiding a lot of red meat. Okay.
Na wanaume nyama na wanaume. That is possible, daktari.
It's worth knowing because what does not kill you, others say makes you stronger, others say it destroys you. Yeah. So it's worth it to note that you don't want it to destroy you.
All right.
So if you taking meat and you're in your comfort zone, and you feel after all so and so is surviving. Remember, we have also other attachments of someone having this cancer of the prostate, you not having it because of other things like genetics and so on and so forth. And it's very difficult for people to track the idea of genetics. Yeah, like for instance, like I might not be able to look back and reflect on how my grandfather lived and
there was nothing.
You get the point. And these genes have been extended to me. So it is okay because these things have been researched on and have found to pose some direct implications to avoid this red meat. Okay. To avoid to quit smoking for those men that do smoke, especially cigarettes. And men should exercise and encourage yourself to have a regular exercise regime, right? To ensure that your hormones are balanced. We began by talking about hormonal implications on the testosterone, which is a hormone which, whenever it's produced in excessive, makes the prostate to enlarge. Then we have other things like stress levels. Okay. they also push men to development of these prostate problems.
Okay.
And of course, the other thing is men should also have we call them pelvic muscle exercises. You can be able to exercise to train your bladder, to even be able to be able to cope with conditions which can pose other problems to the prostate, like infections, which can infect the prostate, what we call prostatitis due to infection, which can then later culminate to cancer of the prostate from the infection. That's an area we didn't cover. We have infections that can affect the prostate and have the prostate develop cancer in later age.
Okay.
Yeah.
Would you touch on them? What kind of, that is, what are they called? UTIs or something?
Yeah.
Okay.
Yeah. We can have infections affecting the urinary tract.
Yeah.
The urethra is normally divided in men. Okay. We have an anterior part of the urethra, we have a middle part, and we have the last part, which is the prostatic urethra. So the area that is covered by the prostate, that is the prostatic urethra. Sometimes whenever a patient has infections, cystitis, infections affecting the bladder, infections affecting the urethra, that part, continuous, these infections have been treated, have not healed. They are continually treated. Sometimes they cause scarring of the urethra around the prostate and also affect the prostate.
Okay.
Yeah.
Let me ask a question. When I do workouts, and I love how people see workouts. Someone might see you going to the gym and they think you have all the time.
Yeah.
They will not understand. So please, I want you to break down. When you tell our men to exercise, are you telling us to go to the gym for 1 hour? Would you break it down to something that is manageable in their lives and something that is applicable in this economy? When I say economy, you understand what I mean by
Got you.
Yeah.
Very well. For me, this is what I normally advise my patients, the one that I see in the hospital here.
Yeah.
When you talk about exercise, you don't really have to go to the gym to exercise. But the gym is a social place which encourages you to exercise because you're not doing it alone.
True.
One of the challenges that people have on matters gymming is they normally blame time, okay? And they normally blame, like how they look awkward. You get the point?
People think men go to the gym to get six-pack.
It's not really what it is. But I normally advise even those people that have challenges gymming. Yeah. There are exercise routines you can do even from the comfort of your house, Terry.
I agree.
And with the advancements in technology right now, and I'll advise men, you can basically just even Google. You Google quick home workout. Quick home workouts. Then you do those quick home cardio workouts. If you can be able to exercise along those people that are doing those things there, it works. I have done it several myself, and I know it does very well. And it can improve your overall life. And then normally say the garbage in, garbage out. So as you exercise, also it's good to note that you don't just exercise and eat everything that you come along.
Okay.
Yeah.
Daktari, I'm sure this topic we will have a lot of questions that are coming on board, and I hope you'll be there to answer questions.
Yeah,
because
definitely.
I promised our viewers that if they have any queries on this episode, we'll get back to answer the questions, either through a form of text or answering the comment section. Now, without further ado, I want us to address on an issue. I know we have moved from NHIF to SHA, and we are talking about cancer patients. Would you like break down to us what are we expecting when it comes to cancer patients and what is SHA offering at this particular time? Yes.
Oh, very well. I think that's the elephant in the house right now.
I know.
And let me maybe allay the anxiety in the viewers.
Kindly.
That change is good, and change comes with some sort of resistance, and this and so forth and so on.
Yeah.
What I think is important to note is that even if Terry you are taxed, or rather, if you you have deductions in your salary to pay for an insurance, sometimes, and maybe you don't get sick, that contribution goes to the money pool that helps another person that is sick. So today it's the patient, tomorrow it might be you. So it's okay, even as we have the outcry to our various stakeholders to have these cuts and changes in how much is taxed from the people. I think SHA is notably covering almost everything that the patient may need on matters treatment, especially on matters prostate and so on and so forth. I mean cancers. And like for us here, we don't normally have an oncology center. But the few people that I've interacted with, my friends that run these facilities, they basically are highlighting that SHA can be able to comprehensively manage these things. So I think I ask people to subscribe because it's a step towards being able to manage people wholesomely, not really focusing on the ones that are sick right now, but even the people that are the other populations that cannot be afford the treatment that you and I can afford. Yeah, so that is it for now. And I hope I'm clear on that one.
Yeah, you are. But I have a question on behalf of myself and other Kenyans. Are we talking about it assisting now or in the future?
I think I would say I'm not the best suited person to answer that question, but yes, when we talk about insurance, we talk about something that perhaps is going to be improved as time goes by. But currently, like where I sit in the Potter's Family Hospital, we normally are able to treat patients with this SHA insurance. Okay. Despite the various challenges that there are challenges there, I can assure you, because we have looming financial constraints that is countrywide, and especially in healthcare because of the defunct NHF and this one and that. But our hope, we just live on hope that the involved people can be able to troubleshoot these things faster, because they relate to Mananji, and they should be able to sort the patient even as they sort as hospitals.
For me, I actually don't have a problem, if I may say that, but my worry would be that we are going to have people deducted a huge amount of money rather than the one that we started with, around 500 to 1,000 to 1,500. Then again, it would be discouraging or unfair to make them not benefit from the deduction. So we're hoping, as you're saying, that with time they are going to sort it out. It's going to be beneficial because people are really sacrificing for these deductions, and it's again interfering with their lives. So let's hope for the best. In the meantime, as we come to the end, we're going to have Dr. Anthony tell us more about his facility. That is where we are at the moment. It is directly opposite Marble Hotel, for them that are in Embu County. So he's going to tell us more about his practices and what kind of services you can get in Potter's Family Hospital as we come to the end of our show today.
All right. Thank you very much, Terry, and dear listeners. Began to saying I work in a facility called Potter's Family Hospital. Potter's Family Hospital is located in Embu County. We are direct to the Marvel Hotel in a town called Mutondore. So we offer a number of services. We have outpatient and inpatient services. And we have been operational since the year 2014. And what I would say is we run both general and specialist clinics. This to mean that our services cut across our family. Bound. We treat all members of the family in terms of we have a specialist for kids, pediatricians. We have specialists for special conditions such as the dental health, ENT, that is ear, nose, and throat. We have specialists for eyes, that is ophthalmology department. We have a maternity, so we assist mothers we conduct deliveries. We have a theater, so we do all manner of operations, from minor to major operations. And we also admit patients for inpatient care. We are a 50-bed capacity hospital. So, dear viewers, if you are to visit us, you're not going to find me alone. We work as a team, and we are very passionate in what we do, and this is what we pride ourselves in. If you happen to visit us, you're going to be happy with our services, and we value your feedback. And notably also, in case you have a consultation or rather you have some questions you'd like to air to us, I think, is it okay if I share my number?
Yes, you are free to share your number.
You can have my number for future reference. You can talk to me. I'll be more than willing to help you. My mobile phone number is 0711 178 580. That is 0711 178 580. So I look forward to being able to discuss these things with our viewers today in a more private approach.
Okay.
Thank you.
To our viewers, we want to take this opportunity to thank you for staying tuned to Inclusive Reflection Show. We are trying our best. This is my prayer. I've been looking for someone that can address issues to do with prostate cancer, I think, for the last almost 5 to 6 months.
Is it?
Yes, I
really?
have looked. And this doctor here, he's ever busy. Sometimes I think he's usually in Royal Media Services with Wemwaro radio. So his program and mine has been like, I'm on and off. And I purposely came from Nairobi to handle this because our viewers, this is how much you mean to us. We no longer want to lose men to prostate cancer. Ndugu zetu, tunaomba muonge, talk, visit daktari. I'm sure with him now, he's a man like you can be able to dissect all the problems that you have, and we are sure that you're going to get the help that you need. So thank you so much for staying on board. For compliment, for questions, we urge you to watch this episode, share it widely, let us enlighten our men in the society, and so that we don't keep losing them to prostate cancer. Until next time, if you have not subscribed, kindly don't forget to hit that subscription button so that you don't miss out on whatever episode we air. But up to this point, thank you so much for joining Inclusive Reflections, and may God keep you. And I think at this particular time, I'll start saying Merry Christmas,
Merry Christmas,
and a Happy New Year. God bless you.